Thank you, Dr. Louis Shaper, for the introductions. So, assalamu alaikum wa marhaban wa ahlan wa sahlan. Normally when you see the thank you slide, traditionally, the thank you slide always comes at the very end of a presentation. And so don't be excited that my presentation is about to end. No, but I really wanted to just take this time to really just acknowledge some people for their very hard work in making this event a true success. I begin with thanking His Excellency Dr. Tawfiq Al-Rabia, who's the Minister of Health, for really sponsoring and providing us this platform. I thank His Excellency Dr. Bandar Al-Qanawi for inviting top scholars from all over the world to share their knowledge with us. Equal thanks goes to Ms. Wiam Ad-Dakhil for emceeing this summit. I would also like to acknowledge Dr. Ra'id Al-Hazmi for being a great educator and expanding my knowledge base on clinical business intelligence systems. Mr. Tariq Muhammad Rana for providing feedback on my work. Also to the wonderful people at Richard Ed.S and Associates for their technology support, in particular to Ms. Dorothy Atkinson and her team. I had the pleasure of working with Jacqueline Gross, Mona Hamidi, Tawsif Khan, Sophie Titulo, Cesar Halal, Daniel Abrams, and Sarah Putterman. I thank Dr. Jawad Abdul Jawad as well. In addition, the chairs and co-chairs for making these sessions very engaging. Lastly, to the 60,000 plus attendees, like Shukran Kathir and Shukran Jazilan, for taking the time to attend and really join us today. The title of my talk is really Wearable Technologies to Monitor High-Risk Patients During Pandemics. And here there are three entities that are of interest to us. One basically here is the wearable technologies, what they are. The second is high-risk patients, and the third is pandemics. And I thought what would be very nice is if I could just give you a little bit background information on all three, and then put everything together. We begin with wearable technologies. So by definition, wearable technologies are devices that are worn as an accessory, right? And there really is a wearable device for every part of the body. So as can be seen in the illustration and the figure on this slide, there's devices for the face, right? There's devices for the hands, the legs, the feet, and the whole body itself. Now, these devices really collect, track, and they sync data to either a smartphone or a computer. The sensors really record daily activities and biometric patterns. And by health sensor, what I'm really talking about is the hardware, software, and the data model analysis, plus the artificial intelligence. So the uses of wearable technologies are many. I've listed some of them here, but they're mostly what we see them being used today really are for biometrics. And biometrics, we're talking about the monitoring of like the physiological functions. Here we're looking at the vitals, like the patient vitals, the temperature, their heart rate, their blood pressure, right? Maybe we're detecting their emotions, their sleep patterns, and so forth. We can also use wearable technologies to do electrocardiograms, as well as augmented reality. The augmented reality is something that's very new that we see coming up and emerging. Another use of the wearable technologies is doing GPS. This is really the global positioning systems where we do real-time location tracking. Last but not least, you can also do real-time contact tracing through radio frequency identification. So here in this slide and then in the next couple of slides, I'm going to be displaying and talking about some of the wearable products that are out there from various companies. Now, for just record purposes, I would like to just state that In no way am I being financially compensated from these companies, so there is no conflict of interest. So we'll begin with the smartwatches, and usually in the ones that we see very popular in the market today are like the Galaxy Active 2. Some of you may actually be wearing them as I'm presenting. These can be synced to a mobile device. Fitbit is another example of a smartwatch, and then you also have the Apple Watches, which is also very popular. Right? The watches, just to let you know, they really do collect the biometric data, and that data, like I said, can be transferred to a computer, laptop, or the cloud. We then move on to the next example of a wearable technologies, which is they're called head-mounted displays, and I provided two examples here. One is of Google Glass, and the other is Microsoft HoloLens. Now, this wearable technologies is used for augmented reality. We see a lot of businesses using this item to train their employees. At the medical school where I presently teach, we are implementing these head-mounted display to train our medical students when we go to teach them anatomy. We also have garments, right? So these are smart biometric garments, and the biometrics are embedded within the garment itself. So this is an example of a product from Hexoskin, and this garment, it has been designed for both males and females, and you can see that here the vitals that this garment can pick up or track or collect data on would be the individual's blood pressure, their activity level, their temperature, their oxygen levels, 3-lead ECGs, and their breathing rate and volume. Now, this data again can be transferred to a mobile device, as you see in this slide. We also have something called like jewelries or medical alert systems here. So I've provided three examples. The first one that you see is the Aura ring. It's very light. It's made out of titanium. You wear it like a regular engagement ring or a wedding ring, and this may very well become people's wedding rings and engagement rings in the very near future. It's really packed with infrared LEDs, temperature sensors, and an accelerometer and a gyroscope, everything all in one in this small ring, right? And this ring really captures an individual's pulse, their movements, and their temperatures. The second is the pulse ox, and the pulse ox really became very popular in the US when the pandemic happened. At one point, it was very hard to, they were all sold out. And we know that in the pandemic, one of the things that happens to our patients is that, their O2 levels begin to drop. So a lot of the people started to purchase the pulse ox, so that they could maybe keep a track of their oxygen levels. The third thing that sort of falls into this category in terms of jewelry is like the life alert system. And what you'll notice on the slide is that there's a small little a module that you see that can be placed around your neck like a necklace. And this life alert really became very famous in one of the ads, for life alert. There was this elderly woman who sort of fell in her house and no one was there. So she presses the button on this device that's around her neck and she yells, "Help, I've fallen and I can't get up," And moments later in the TV commercial, you saw the ambulances arrive. So again, these are just specific examples of wearable devices. There's another category of wearable devices called SAMDs. These are software as a medical device. So here I provided two examples that we see in the market. One is the RFID. Now these RFIDs were first introduced. We first saw them in clothing department stores, where the stores put these. The stores basically put them on the clothing items so people wouldn't steal. But now we're using them to track patients in hospital. The other is a cardiomobile. So here we place the leads on the back of the phone, which is what you see in this diagram, and you can take ECGs here. That was all about mobile wearable devices. I want to just talk about high-risk patients. Now, when the pandemic started in the U.S., right, there were many patients of interest, right? We were all being told that we should all be careful. But then the focus then somehow the focus then got shifted to particular high-risk patients. So it really started out with the elderly, right? That often had chronic health conditions like obesity or diabetes. Then the focus moved on to like the healthcare workers who were actually treating all of these patients. And then now with the schools opening up, we see a lot of attention being placed on children. However, apart from those high risk, apart from those, we also, there are other categories of people that fall into this category. So pregnant women, people from indigenous races, groups that are underinsured or uninsured, really also are considered high risk patients in pandemics. Right. So the needs, I think it's also important to know the needs of high risk patients. And sometimes technology can't provide the solution for everything. If all of you remember, a number of patients who had the COVID virus, complained that they could not breathe. And there were also a number of cases where the patients would say, I cannot smell. So we don't really have any medical device that can pick up symptoms of like patients not being able to smell. So one of the biggest important things here is that the voice of the patient really becomes important. And we have to ask ourselves, are we really listening to our patients? Now, when EMR systems were being implemented in medical practices and hospitals, everybody was very ecstatic. There was talk that the technology was going to reduce medical errors, possibly lower the health costs, And when we saw the implementation of the EMR systems, one of the things that we saw was a decrease in communication between the healthcare professionals and the patients, right? So, let us not do the same here in this pandemic, with these devices. And what's sort of important is that there are some patients that really are low-risk patients that can turn into high-risk patients if we don't really listen to what they have to say. And in the United States, about 18% of the rising patients escalate into high-risk category when they're not managed properly. Okay. Now we sort of move on to the third entity, which is the pandemics, right? So the question is, what really is a pandemic? We know that epidemics, right, is a disease that affects a large number of people within a community, right, a population or a region. So a pandemic, by definition, is an epidemic that's spread over multiple countries or continents. So you can basically think of pandemics as having passports. So it's really an epidemic that's just like doing some traveling here. And in this slide, I've listed some of the pandemics that we've encountered in history. The Spanish flu being one, the Asian flu, Hong Kong flu. We had the AIDS pandemic, the H1N1 swine flu, and now in 2019, 2020, we have this the COVID-19 pandemic, and we have to date there are over 700,000 death tolls that have resulted from this pandemic. So it's sort of important because with that high number, I think it's important for researchers and scholars, right, to really take a look at some factors for consideration. And in here, what's important is that we have to ask the 5 W's and the 1 H. So the 5 W's are the who, what, when, where, how, why, and then the H happens to be how. So some of the questions we should be looking at is, who contracted the disease. Here we're determining who our high-risk patients are. What symptoms are they presenting with, right? It determines the spectrum of illness. When did they contract it? It determines the timeline. Where did it start from and where is it going? It helps determine the geographical spread. Why did they contact it? It helps determine the context and how can we make more sense of this data collected? It determines the strategies that lead to a solution. Now, there are a number of factors that here we have a number of strategies that we can use based off of the factors for consideration. Now, all of this really, these current strategies, are up for debate, and there is a lot of debate on them, but we initially started with surveillance, then we were told then the focus was on hygienic sanitation practices, then we focused on the PPEs, now we moved to social distancing and quarantine, but there's a lot of utilization of telemedicine, telehealth, and there's like drug development and vaccine development going on, right? So with all of that, with the three entities, now that you have some background, let me just quickly talk about some putting all the pieces together. So we have wearable devices in the market that detects changes in health patterns. So there was a DETECT study that was done by the Scripps Institute, right? And participants could opt in and basically share their data on their heart rate, sleep and activity levels, as well as respiratory symptoms. And the reasoning behind the study was that infected people really experiences changes in their health patterns. So these and all of these health patterns, are measured by these wearables. So if you're able to monitor the trends, you can then maybe spot an outbreak much earlier. We also have wearable devices for proximity alerts or contact tracing. So there's a company here called K2, right? They provide wearable devices for really proximity and alerts. So if we have two people, if there are two or more wearables in range of less than 6 feet, the device will begin to vibrate. Remember, in the pandemic, patients that had pulmonary issues, right? They really are our high-risk patients. So there was a study done by Tay, An, and Chung in 2017. They designed a remote rehabilitation system for a multimodal sensor-based application. And this system really it provided these patients with pulmonary issues, their exercise tracking progress, their patient performance, their exercise assignments, and their guidance. We also have wearable technologies for patients that are immunocompromised or those that are cancer patients. So there was another study that was done using a wearable activity tracker. In this case, it was a Fitbit Alta, and they found that using this wearable technique programs, it really had the potential to provide effective, intensive home-based rehabilitation. There's also remember, the elderly are also a high-risk group of patients, so there is a wearable device for them. It's really this belt that they have, and this belt basically has aided in it's really a fall detection system that's put around the waist, and it really can help the elderly to basically for fall prevention. Now, there are several positives of having wearable devices. So some of them I've listed here is the real-time data capture, right? So wearables can really, they already collect a wide array of data. So these metrics are critical information for healthcare providers dealing with high-risk patients, with congestive heart failure, diabetes, and other conditions. Now, there is a talk that in the near future, wearables will most likely collect other additional biometric data like blood glucose levels and blood pressure through non-invasive sensors in real time. There's continuous monitoring, right? When we wearables provide a contextual continuous data instead of a snapshot in time that clinical monitoring provides. Presently, when we go to the patient, to the clinical's office, the clinician takes our vitals, and it's really just a snapshot in time. But if you're able to see a patient's, weeks or months worth of relevant data, it may help the clinician in better providing patient health outcomes. There's a lot of prediction and alerts, right, that these devices provide. here. And lastly, it also increases patient engagement. And really, most individuals, want to have a role in improving their health. Patients who are actively engaged in their health issues will be more motivated to change, and wearables allow patients to interact with their health and lifestyle behaviors. There's also negatives. One is the cost and the affordability. Not everyone has access to these wearable devices. So just a smartphone like a Samsung or an iPhone, costs anywhere from $700 to $1,000, depending on how much memory you put in. The Oura Ring that I talked about is about $300 to $400. The Exoskin is about $400. So these are wonderful technologies, but if you can't make them accessible to everyone, then we really may not be really helping everyone. There are privacy issues. So, in a presentation that Dr. Al-Hazmi gave yesterday, there was a slide on which he discussed, there was a study by the University of California that examined, perceptions of data sharing and privacy among various generations. And baby boomers who were born between 1946 and 1964 were most concerned about, data sharing and privacy, but 40%, that was 47%. But the Generation Z, which were born from 1997 to the present, were the least concerned at 28%. There's also security issues. So, in 2018, there were like 702 data breaches. It affected over 600 million people. In 2019, there were 493 there were 811 data breaches, which affected 493 million individuals. And to date, in 2020, we've had 540 data breaches that have affected 163 million individuals. There are ethical issues when we come to wearable devices. These devices are developed by private firms, and they're not part of a traditional healthcare system, so they're not covered entities. So the private firms in general have a commercial interest in selling their devices or the data the devices collect. So as such, these wearables are not subject to the same regulatory scrutiny and oversight as the other medical devices. And they don't offer the same level of control and privacy protection individuals have come to expect with regard to their healthcare. Right? So the market really, the market for the wearable devices really is just expanding. According to this slide, you see that there's a lot. In 2019, we had $32.63 billion worth of investment in this, and mostly we see it through wristwear and eyewear. And this is expected to grow. And I really end with this. I really would like to end my presentation just by sharing a simple little message with all of you. Now, in Arabic, there's a word to describe somebody who is unbiased, fair, and just, and that word is called adil, right? For masculine, adila for feminine. Now, the root of this word is adala, which in the infinitive, right, means to act with integrity, straightness, or rectitude. And in this pandemic, many people have died, but this pandemic has also provided opportunities for growth. And it has brought like wonderful minds together, and this summit is a perfect example. So based on what I've heard thus far from our speakers, we have a lot of work to do ahead, and things will probably get worse before they get better. And the question is what lies ahead. We know that we need to collect more data. We need to better clean it and mine the data. And our prediction models need to be perfected even further. And we have to give thought on the information that we're disseminating. So it is okay to look forward and to provide hope, but giving false hope is very unjust, right? So let us strive towards developing products and publishing work that are really very conclusive. And everything else should be secondary to that. Only then, I think, will we be adil in our thinking and in our actions. And with that, I thank you for allowing me this opportunity to present.